right, so I'm Tina, and then Jenna is here too. She was already here, she's waving. So we're both registered respiratory therapists and certified respiratory educators, and we'd like to welcome you to this Better Breathers Club of BC session today. We'll just get our slideshow going here.
Octopus tentacles. You're going to start with chunks of clay.
Oh. Okay. Is that okay? Okay. All right. Shall I get things going here, Jenna? Yeah.
Yeah, so let's we would just first and foremost like to thank BC Lung Foundation. So thank you, BC Lung, for funding the Better Breathers Club of BC, hosted by Poplar Pulmonary Wellness. And we would like to acknowledge the lands on which we all gather here today, where we work, live, and play, as the unceded traditional and ancestral territories of the Coast Salish peoples. Tina and I are coming in from speaking to you from Vancouver today. So for us, that's the Squamish, Musqueam, and Tsleil-Waututh nations. And you're welcome, if you'd like, in the chat, just to type in the lands on which you're joining us from this afternoon.
Yeah, spell it.
There.
Oh, you can let us know, Alan, if you want.
Well,
Sometimes they're more challenging to say.
Exactly.
We'd like to thank you in advance for creating a safe space. So here at the Better Breathers Club of BC, we feel that everyone's free to share their thoughts, values, opinions, especially ask your questions, please, without fear of judgment. So we thank you for creating this safe space for everyone. We'd like to acknowledge that the information shared here is for educational purposes only. It does not substitute professional medical advice from your healthcare provider. Sometimes this gets cut off at the end, so we just wanted to let you know, if you're looking for more, as a collaboration with the BC Lung Foundation, we are hosting the Harmonicas for Health and Happiness program. So if you'd like some more information, you can visit us on our website, where we are booking intake sessions and have 3 sessions in the new year, 1 in January, 1 in March, and 1 in May. Super fun program to improve lung strength, which we're going to talk about today. And if you have not met a respiratory therapist in your community, if you're looking to meet with one-to-one, we do offer Poplar Clinic. So we do offer a complimentary 15-minute session. Just give us a call, give us an email, and we can connect you with a respiratory therapist to guide you on your lung health journey.
Awesome.
And I'd like to introduce Tina, who's going to lead us through our discussion on pulmonary rehab today.
Awesome. Okay. So yes, we have some goals for today. We like to set out some goals today with our time together. So we would like to do these 3 goals. So we're going to be talking about pulmonary rehabilitation. And what we'd like to do is increase your understanding about what pulmonary rehabilitation is. We would like to let you know how it helps improve our breathing, fitness, and quality of life. And we'd like to let you know what to expect from a pulmonary rehabilitation program. And before we get started, we'd like to have a little bit of discussion. So just to frame the topic here, we would like to know from you, what helps you breathe easier? So what helps you breathe easier? What do you do when your breathing feels tough to make your breathing feel easier? Or what helps you to feel more in control of your breathing? So if you'd like to just share it, go ahead. You can put your hand up or you can type it out in the chat. Or you can unmute yourself. Did you have something to share, Teresa?
I don't know. I'm thinking.
Okay. Yeah. Yeah. So if you think about moments where your breathing feels tough. You feel a little bit of shortness of breath. What are things that you might do in that moment to help you feel better?
Well, you have to try to, like, if I always feel like I can't breathe when I'm anxious or excited about something.
Yep.
So I always try to bring myself back to like a calm, like just say in my mind that, everything is going to be okay. Instead of, I used to always go to my Ventolin inhaler like
Yeah.
right away because I would panic. And now I'm trying
Yes.
to not do that.
Okay.
Yeah, it's really hard though.
It is hard. I like what you're doing. So that sort of positive self-talk can help a lot.
But
Yeah.
it's hard. It's still because I still feel it's a horrible feeling. Like when I go upstairs, because I have to feed my cat up. She's upstairs. She's really old right now. But anyway,
Yeah.
as soon as I go upstairs, I feel like I'm gonna die because I can't breathe. But I don't
Yeah.
pace myself because I get anxious and I go up really fast and then I can't breathe. And then I'm like, it takes me like 5 minutes just to be able to breathe again. Oh my God, it's horrible.
You're not alone, Teresa.
Well,
Yeah, it's really bad.
Teresa, I know it's hard to because you've been so used to it all your life just to walk up the
Yes,
stairs.
exactly.
But I hear you, and I've got to go up a few stairs at a time, and
I
then
know.
stop.
I have to try to train myself because I used to be so fast at everything, like working in dentistry, you're used to working so fast. And now it's like,
Me
I
too.
can't do that. And I'm like, I don't know. It's really, really difficult.
I'm 15 years into my condition, Teresa, and they're still telling me to slow down
Oh my God. Yeah. Well, I guess
because I
there's
walk
hope
too
then.
fast.
I know, right? They always tell me slow down so you could do your pace, like with your, because when they test your oxygen, like I try to walk too fast and then it goes below 88, but it has to be below for more than a minute before, and it's just because I'm trying to go faster than I should be going. And I
Mhm.
can't even talk when like I get home today and everyone's asking me questions about my eye exam and I'm like, I can't even talk because I can't breathe.
Right.
Like I couldn't even talk. That's how bad it was.
It's
Wow.
because you have no oxygen.
Exactly. And you can't even
Yeah.
talk. That's frustrating, right?
Yeah.
Like it's very frustrating because people ask you questions and you can't answer them because you can't talk.
Yeah.
That's
Yeah.
exactly what
We
happens.
Well, I'm
Yes, I'm
glad
sure a
someone
lot of
else is
people
doing
can
it.
relate to that problem.
Oh, I'm
Yes.
glad because I'm not alone then.
not
No.
alone. We have some
Mhm.
comments in the chat too. So Gord shares that he stops movement to focus on his breath, which he finds helpful. And Lynn has shared deep breathing. So
Yeah.
inhaling in through the nose, exhaling out nasally as well. And pursed lip breathing is something that works really well for
Yeah. When you're panicking, it's hard. It's easier said than done because you have to
yes.
train your mind to do that, right? So, yeah, it's
Yes.
all a matter of like reconditioning your mind.
So
Good.
deep. I love the conversations that we're having here. Thank you so much, everybody, for sharing.
Yeah.
So, the type of things that you just shared here and the situations that you've shared here are exactly the type of topics that we'll be talking about in pulmonary rehabilitation. So, you could think of pulmonary rehabilitation as a program that brings in all of these pieces together, that pacing, the anxiety piece and how to deal with it, the shortness of breath, how to manage exertion, how to slow things down safely, oxygen levels, all and retraining your brain, right? So all of these things kind of come together in pulmonary rehabilitation. So thanks everybody. I thought we would maybe touch on some of these, but I didn't think we'd touch on so many. So that's great. So we'll keep the discussion going. And so that is a good example of the type of discussions you would have in a pulmonary rehabilitation program. So pulmonary rehabilitation is a supervised program and it combines exercise training, education, and support to help you manage your chronic lung condition. And there are several components to a pulmonary rehabilitation program. So there's exercise. We learn breathing techniques and those energy saving tips. We've got education about medications, because we know it very often takes different medications to manage our breathing in our lungs. We talk about how to handle flare-ups and using action plans and staying active. So finding a way to fit exercise and movement into your life to help you stay healthy so that you can keep doing those things that you love. And the other piece is that emotional and social support, which is a very important piece of managing a chronic lung condition. People don't realize, maybe when they first have a chronic lung condition, that there is such an emotional toll that happens. This anxiety piece, even depression as well, is very common, and it is part of managing a chronic lung condition. And so having that social support from other people who get it, who've been there, as well as support from professionals who are running the supervised program. And so pulmonary rehabilitation is not just exercise, it's all of these pieces that come together to learn how to live your best life. And so here at Poplar, we have our motto, which is get out there and live your best lung life. And so it's this pulmonary rehabilitation that can help you to achieve that. And so that's the very real, oh, go ahead.
Oh, yeah, I was going to say in that slide, just emphasizing the supervised part, because Tina and I often speak about this, that PR, which stands for pulmonary rehabilitation. So PR often sometimes needs PR, public relations, because there are programs out there that say pulmonary rehab, but they're not always guided or supervised. Tina's going to get into this more, but a program that really personalizes the program to you, tailors all of these aspects specific to your situation, is really, really key to get the best outcomes from a pulmonary rehab program. So definitely, if you're looking into programs, which we'll talk about in a little bit, look for ones that are supervised. Very key.
Can I just say, being part of your pulmonary rehab that you and Tina have, it's more than just an exercise that you can do on Zoom. So if you have a concentrator, it's fantastic. Like I need that when I'm moving. but we're all there to support one another. Just like, when something is when something comes up, there's always somebody else that's already gone through it. Or they might give you ideas on, well, try this, and just to help you get through it. Do you not agree with that, Jenna?
Oh, yeah.
Yeah.
100%. Yes, absolutely. So so that camaraderie piece, I think people who go through programs, and we'll open up the Zoom room again in just a bit, really say that the camaraderie piece and that interaction with your peers, and the way you, and Alan's nodding his head, I see, the way you help each other out, it's something, it can't be explained, it can't be bottled, it can only be experienced, and because chronic lung conditions are something you live with for a very large portion of your life, that piece is so important to kind of carry you through the ups, the downs, whatever it is. So we'll get into that more. And thank you so much for your comment, Jane.
Well, you know why my head was bobbing up and down, because you read it there this summer in August. One of the main things to me, and especially while you both know it, dealing with you, everybody that I've been in contact with has been very positive, very upbeat, with the attitude that you can do this, you can beat this. And that positive attitude rubs off. It infects everybody that is exposed to it. It's one of the things that made such an incredible difference to me, was that positive, upbeat attitude all the time.
Thank you,
Thanks,
Alan.
Al.
Wow. Yeah, it's such and Jane, like you say, you meet people and they carry you through. And it's, like Jenna, you were saying, that can't really be explained. It can only be experienced. But we see it regularly in our groups, especially in our maintenance groups, where over time you really get to know people. And if, someone doesn't show up at class when you would expect them to, we're checking in, we're sending an email, be like, are you okay? You know, like you want to know, they're in your circle of caring, and you end up, sharing your lives together, and you get to know about so and so's granddaughter, and so it really is quite the connection, and that, especially with a chronic lung condition, becomes very important because we get isolated. As it gets more challenging to leave the house and go out and be social, especially with pandemics, for example, you want to still have that contact. And the ones that are online, at least, you can still show up if you're not feeling that well and say hi and do what exercise you can without making a lot of effort in the overhead to go and leave the house and go somewhere. So it's quite accessible in that sense. Thank you so much, everyone, for sharing. I love that. Okay. Well, what you guys talked about is the real definition. This is the technical definition, as explained in an article in the Canadian Respiratory Journal in 2015. And one of the people that worked on this article is Dr. Pat Camp, whom we know and love, who is a big supporter of pulmonary and designer of pulmonary rehabilitation programs. So they've defined pulmonary rehab in this way, which is more the technical components, and I'll go through it and I'll explain it sort of as we go. So it's important that a pulmonary rehabilitation program is evidence-based, and that means that there's been research done to show that pulmonary rehabilitation is effective. And we know that it's effective because there's been plenty of research done on pulmonary rehabilitation programs. And because of this research, we have certain criteria that Jenna was alluding to earlier. So there's criteria that define a pulmonary rehabilitation program. And so they're defining it here as a comprehensive intervention for patients with chronic respiratory disease who are symptomatic and have difficulties with activities of daily life. And I will say, don't wait until you have difficulties with daily life. You can take pulmonary rehabilitation when you get your diagnosis. And we know that the recommendation or the referral doesn't always come in this early. And so this is why we want to spread the word, and we want to let people know there is pulmonary rehabilitation available for you when you get diagnosed. And that's where you go and you learn about the disease and you learn how to manage it. So you don't have to wait until you've got these setbacks or challenges, although if you do, that certainly does provide a good amount of motivation to participate in a program. But you don't need to wait until you start having some deficits and try to claw that back. It's okay to work from the maintain point of view, which is very important. And so what does pulmonary rehabilitation, or PR, I'm going to say PR because it's a mouthful otherwise. So PR reduces dyspnea. Dyspnea is shortness of breath. So it reduces shortness of breath, optimizes functional status, and that is usually measured by doing your activities of daily living. Can you take care of yourself? Can you make some food, eat your own meals? Can you walk around? That kind of thing. So it optimizes your functional status. It reduces healthcare costs. That might not sound like it's a perk to you, given that we're in Canada and healthcare is free. It certainly motivates the healthcare providers to provide PR programs, but the way it reduces healthcare costs is that it means that you don't get sick as often and you don't have to go to the doctor or the hospital as much. So that should be of interest to you. And it does that by improving your self-management skills.
Oh,
In other words, you learn tools to reduce your shortness of breath and to stay healthy so you don't end up getting sick and those flare-ups as often. And it can stabilize or even reverse some of the, when we say systemic manifestations, that means symptoms. So it can stabilize or reverse some of the symptoms that you're having by having better management of your condition. And then comprehensive PR programs include patient assessment, exercise training, education, and psychosocial support, as we've mentioned before. So it is all three of those pieces: exercise, education, and support. And it's recommended for people with COPD. A lot of the research has been done on COPD patients. And so this is, you'll often hear about pulmonary rehab for COPD, but it's also for people with other chronic lung conditions. And there's still research ongoing about different lung conditions and the benefits that it might have for those. And we already know that it has benefits to people with interstitial lung disease, or ILD, like pulmonary fibrosis. People with lung cancer most certainly benefit from it. Pulmonary arterial hypertension, pulmonary hypertension, and people who are going to be getting or who have just had a lung transplant. So it is good for many, many people. Our program is open to people with any lung condition, as are other programs. Some might be restricted, maybe only to COPD, but hopefully that's less and less the case, where they can open it up to more people. And feel free to stop me at any time. If you've got a question, you can put your hand up or type it in the chat. All right, so now that you're experts at calling pulmonary rehabilitation PR, so how and why does it work? Like, what does it actually do? So, pulmonary rehabilitation improves your muscles' efficiency, meaning you can do things without using as much oxygen. And how do we do that? Sneaky, sneaky, exercise. So
And maybe
exercise,
Tina,
yeah.
sorry, Tina, maybe you can explain sort of like what happens in the trajectory of living with a lung condition that gets you to the point where this muscle efficiency is so important.
Sure. So yeah, so muscle efficiency. There is a motto I've used when I've been doing exercise, and that motto, which helps explain this, is your body responds to the demands you place upon it. Your body will respond to the demands you place upon it. And I'll give you an example of this. If you live in a home with more than one level, like a townhouse or a two-story home, and you walk up and down the stairs regularly, that's a demand that you place upon your body. If you move to maybe like a single level home or a condo or something where there's not stairs, the demand is taken away. And you will find that over time, as you go to climb stairs, you might hear that voice in your head saying, "Boy, I really can't climb the stairs like I used to." And it's not necessarily because you're getting older or your lung condition is progressing. This would happen to anyone who changes the demand that they put on their body. And so if you stop going upstairs, you will find that perhaps one day you can't go upstairs, in an extreme example. And so when we use our body, it adapts. It adapts to that demand. So if we push ourselves just a little bit in a comfortable zone, I'm not talking about doing crazy things. I'm talking about just that little consistent demand. Your body responds. So when it comes to muscles, for example, and oxygen use, we can make more blood cells. Our body will do that automatically if it needs them. We can make more mitochondria. Mitochondria are these little cells in your muscles that produce energy. And so if you have more of these things, your body will produce that energy more easily. It's more capable of doing that. So there are a lot of adaptations that our body makes. It's very subtle to exercise. And this is what we're talking about by improving your muscles' efficiency. So when your muscles are more ready to work, they will work more efficiently, and you will be less short of breath if you are more fit. So So that's one piece with the exercise. Is that what you were leaning into, Jenna? Yeah, okay. Um, Reducing shortness of breath and fatigue. Part of that comes from the exercise, in that your body is more fit and you learn how to do things in an efficient way. But the other part of that is that mental piece that you were talking about, Teresa, that we have to talk to ourselves and how we see shortness of breath and how we can nip it in the bud, for example. We can breathe more effectively. If we can learn to breathe more effectively, then when we go to do these things, they come more easily. We're able to do them because we're breathing better. And doing that will also reduce fatigue as well because you're more fit. You're able to do the regular things in your day without feeling so drained. We
So
do a lot of, oh,
I was going to say, pulmonary rehab is, you can kind of think of it as your practice space, right? So you come to class and you practice in this safe space with the professional who's guiding you on how to manage the breathing, manage the pacing, use the muscles more efficiently, that kind of thing. You practice there. And then when you go out into your world, it's amazing, uh, like Tina said, how you adapt and you take that out with you into your world as you do your different activities.
yeah, so like breathing through movement is something that we work on a lot with the exercise. So it's not just exercise, it's breathing with the exercise. And that really helps a lot. Yeah. And then we did touch on a little bit of it, but there are components of the education that help with this too. So the breathing techniques, so you're breathing more effectively, and then pacing, energy conservation, and a bunch of other of these holistic sort of healthy living strategies that can all work together to reduce overall fatigue and shortness of breath. Yeah. It teaches you how to recover faster from flare-ups. So we do get flare-ups, right? We're getting a cold or viruses are going around or the environment is triggering something in our lungs. So our lungs get angry from time to time. And we learn, first of all, we learn ways to not have those happen. So preventative strategies for flare-ups. But when you do get that flare-up, you can nip it in the bud. You can learn how to manage it right away so that hopefully it's not as bad. So it doesn't get as short a breath or as much mucus and coughing. So if we can reduce those things and try to make it shorter. So speed up that recovery time because you know what to do when it happens and you've learned to recognize the symptoms earlier than you might have before. Don't dismiss them. That's your body talking to you. You got to listen to it. And when you know what to do, you're more likely to listen to it and take those steps. So action planning, respiratory action planning kind of pulls all of that together. Boosting confidence and staying active to stay active and independent. So this confidence piece is a big one. And this is where Jenna was talking about pulmonary rehabilitation is your practice space, right? So you practice these techniques before you even need them. You learn how to breathe right when you're not short of breath, so that when you are short of breath, you just automatically know how to change your breathing and make it right. You can breathe in a way that reduces anxiety. So we learn these things in this practice space so that in your life, when you start to feel that anxiety build up or you've, run to the top of the stairs, oh, okay, next time I'm going to do that differently. We learn ways to manage it so that you feel confident in doing that and you know what you can handle. If you see a set of stairs there, you're like, I know how to do this. I know how to get up without getting short of breath, and you do it. So these are the kind of things that we talk about. I love having these conversations in pulmonary rehab classes because it makes such a difference in people's lives. And connecting you with each other. So you guys know you guys, right? You've experienced this. Other people with lived experience. It doesn't get better than that. A healthcare professional can share some things and we can provide the theory and we can give the techniques, But when you're talking to somebody who's actually lived it, you get these extra little tips and tricks. They're not in the textbooks. These are things that people know from, wearing oxygen all the time or feeling that shortness of breath or having that certain, phlegm removal trick that just works. And so there's a lot of sharing and a lot of caring that go on inside pulmonary rehabilitation classes. Feel free to pop in with comments
Yeah, we
anytime.
do have some comments in the
Okay.
chat. So Lynn just shared that definitely learning proper breathing techniques has helped her kind of manage anxious thoughts and has been a real gift. And Teresa was sharing about different body position to help with shortness of breath. So for her,
Yes.
her body position's more in a standing position. Because that is the other piece is when you're living with a chronic lung condition, you're not the same as someone else necessarily, right? We all have different body things going on. So this guided piece in pulmonary rehab, this idea to personalize the program to you, to even take something as simple as breathing techniques and tweak it so it works for you. And part of that is you getting to know your body and what feels good. And so Teresa is very aware with her body that when she's short of breath, standing's a bit better. Where someone else said, Jeannie was sharing taking a seat when she feels short of breath really helps. And so for other people, really reducing the energy required to stand and taking that off and coming into seated is actually the thing that works. So I love those comments in the chat. Thank you very much.
Thank you for sharing. That's great. All right. So really, what are we talking about here? What to expect out of a pulmonary rehabilitation program? And so we know through research that they should be 8 weeks long. 8 weeks is the ideal amount of time. You will find pulmonary rehabilitation programs that might be 6 weeks or 12 weeks, so they can be longer, but they should be ideally in that 8-week range. You'll be looking at 2 to 3 sessions a week, depending on how it's laid out. So you might have 2 2-hour sessions, you might have 3 1-hour sessions, something like that. Some of the sessions might, like some teach it where there's exercise and education all in one session. Otherwise, you might have it separated out. So some days are education and some days are exercise. The programs run either online or in person. A lot of the in-person ones are run out of hospitals. So there are a bunch of hospital-based programs, but they could also be out of community centers or online. And then the supervised piece. So they need to be run by a healthcare professional. This is treatment, non-pharmacological treatment for respiratory conditions. So you do need to get that expert advice in there. And they can be run by a variety of experts, respiratory therapists, physiotherapists. Those two would be the most common. They could also be run by nurses or kinesiologists. But one important component is that there is a mix of professionals. So you might get like some guest speakers or other people coming in to share their professional advice with you. So like a dietitian or an RT or a physio, if that's not the person running it, kind of thing. So it is a collaboration between healthcare professionals. And that way you get the benefit of all the experts, so they say.
Uh-huh.
And then the exercise should be tailored to you. So generally they are group exercise because it's a group program and that's an important part of it. And so everyone might be exercising together, but you might have variations or options that are presented to you or maybe specifically prescribed to you to do. Most people have more than one issue going on, don't we all? Some people are going to have shoulder problems, hip problems, knee, ankle problems, back problems. People are having
James, like,
some people have all the problems.
All the time.
Yeah.
Stuff happens all the time.
Yeah,
Are
yeah.
you saying we're getting old? Are you saying we're getting old or what?
I said you got problems, Alan. I did say you're old. Yeah, right. So it's important to have that guidance and that adaptation, especially when it comes to the exercise piece. So it should be personalized, these exercise plans. And usually there's a walking component as well. So, maybe it's steps or time walking or distance covered. So a walking program can be part of that as well. And then you're learning at your own pace. And one of the most important things is that if you're in a PR program, you should feel safe. You should feel well supported so that you can enjoy the time. It is a treatment, it is by professionals, but it's so social and it's so the self-management piece where you're learning strategies for your life. You want it to be this safe learning environment where you can ask your questions, share little stories so that you can get that personalized care. And one thing that can be scary to people is this exercise piece. Maybe you don't feel safe if I say, yeah, let's all get together and exercise in a group, especially if you have a breathing problem, right? People are going, whoa, wait a minute. I can't even get to the kitchen. Like, I'm not going to exercise. What am I going to go to a gym and work out? But yes, this is a safe space, and you don't need to prepare to join a pulmonary rehabilitation program. The pulmonary rehabilitation program will adapt for you. So, whatever level you're at, and we have people who are doing all the exercises and seated, right? So, there are people in wheelchairs, people are on oxygen, all kinds of things going on. And the message here is that pulmonary rehabilitation is for you. It will adapt to you. And that's why it's so important that we have professionals running it. Okay, it's not just a cardio class or whatever class that you go to and they just say what everybody should do all the same thing. It's not like that. So we meet you where you're at and you
You
should
also you have,
feel that you get the adaptation. Oh, sorry,
so
go
I'm
ahead, Jay.
sorry. You have two levels too. You have
Yeah.
two levels. Yeah.
Yeah, exactly. So usually when exercise is presented, we'll present a movement and we'll tell you how to make it more challenging and we'll tell you how to make it less challenging. And in our program, we'll tell you how to do it seated and we'll let you know how to do it in standing. So there are plenty of options provided to customize the exercise for you. So don't feel like you have to train before joining a pulmonary rehabilitation program. It's the opposite. It's training you to do the other stuff.
And there's not much medically that will prevent you from attending a program. Usually, our exclusion factors are things like if you've had a heart attack in the last month or a really uncontrolled heart situation, like really, really high blood pressure or angina, like chest pain that's not diagnosed or untreated. So, but everything else, for the most part, you can work with that healthcare professional to sort out. Exercise is something us humans should be doing anyways for all of its health benefits, including, um, healthy heart, healthy lungs, and anti-exercise reduces inflammation in our body, reduces our cancer risks, improves our emotional and mental health. The lists just go on and on in terms of exercise. So there's not much that will exclude you from a program. And these are all the reasons, if we have anyone here pre-post transplant, these are also the similar reasons as to why you're actually mandated to do a pulmonary rehab program after your lung transplant, as an example.
Nice. Yeah, just so much benefit to even doing a little bit of exercise. It doesn't, that you don't hold yourself to anybody else's standards. It's where you're coming from. And usually adding a bit more movement, a bit more exercise can make a big difference.
Yeah.
So a little bit goes a long way. Were you going to add something, Jane?
Well, I know I thought I heard Jenna say that like post after you've had your lung transplant, they like you to do exercise, but don't you also,
Yeah.
it's a prerequisite to have
Pre,
a lung transplant to do exercise?
Yeah.
yeah,
Yeah.
Both, kind of
yeah.
both. Yeah.
It's like they'll kick you right off the lung transplant list if you don't exercise. Yeah.
That's right. That's right. Yeah, so exercise is so important, and it does. When we look at, people who get sick and going into the hospital, the more fit you are, the healthier you are when you go in, the sooner you're going to get discharged, and the better off you'll be when you do get discharged. So it speeds up that recovery. It's like a buffer. It's like you give yourself an ability to get through an illness by building muscle and building health. All right, so call to action for anyone who has not participated in a PR program. So, we're saying maybe you can't change your lungs, but you can change what you do with them. And I'll say, or how you manage them. Yeah. And you can reduce inflammation. So maybe there is also a little bit of a way to change your lungs as well. And pulmonary rehabilitation enables you to do more of what you love with less breathlessness. That is the goal. So why not give it a try? You've really got nothing to lose. And one thing I'll say too, so the benefits of exercise or pulmonary rehabilitation do wane off over time. So it's not like you take a pill once and you're good for the rest of your life. It's like you have to keep exercising to keep getting the benefits. So the goal with pulmonary rehabilitation is that it teaches you these lifelong habits and this self-management piece where you know what you need to do, you need to keep exercising in order to keep getting the benefits of the exercise. And so if you've been through pulmonary rehabilitation before, you could consider doing it again or joining a maintenance program where you stay with that group. You still get that support, get the check-ins, and you get that exercise. Because we all know that staying motivated is very, very much a challenge. We all know we should exercise, but when you look at the numbers of who actually does exercise regularly, I think you find a very big difference between the people who know they should and the people who do. And it takes a village. It takes all of us to keep each other and hold each other motivated and accountable with the exercise. We'll leave you with this tool here, or this website. This is called the Canadian Pulmonary Rehabilitation Portal, and it is a list of pulmonary rehabilitation programs in Canada. And this was developed, it just came out earlier this year. I want to say March or so this year, around there. Yeah. And it's by the Lung Health Foundation, which is an Ontario foundation. And they put together a lot of work for this database. If you are somebody, a healthcare professional who runs a pulmonary rehabilitation program, please do call them up if you want to get your PR program listed on here. And all of the programs that are listed here are vetted. So they phone them up, they ask a series of questions. And we spoke earlier about in this session about the criteria, about having multiple healthcare professionals, the length of the program, the topics covered, the exercise, the supervised exercise and education. So they have made sure that all of the programs listed here meet all of those criteria. So you can go there, you can look up by, I think, postal code or province, and just be aware when you're looking through it, there's a big scroll bar for the whole web page, but when it's calling up the results, it comes up in a little window and you need to scroll through that too. So you might think it just brought up one PR program, but actually there's a separate scroll bar. You need to grab it with your mouse. So I'm trying to warn people about that. You could scan the QR code with your phone, or you could type that in, or maybe Jenna, have you
I've put it
in
in.
the
Yeah,
chat?
yeah,
Okay,
it's in the
so that'll
chat.
be in the
So
chat.
you can click on the link I have in there in the chat, and that will bring it up on a separate browser that you can look at whenever you wish.
Awesome, thank you. And so, one big thing in managing a chronic lung condition is taking that time to calm down and breathe. And the more you practice it, the better you'll be at it. I actually noticed myself doing pursed lip breathing. And then I realized I'm doing it. Like I didn't decide to do it, I was just doing it. And we want you to get to that habit as well because it's such a great breathing technique. It might not work for everyone, so that's okay if it doesn't work for you, but we do find that it works for a wide variety of lung conditions and a lot of people. So this is the technique that we often go to. Oh, Bev came back. She left. I think she clicked your link. Yeah. Um, so if you are okay with it, we just have a couple minutes left here. We can do a little bit of breathing together, doing this pursed lip breathing. So I'll walk us through it. We'll just take a moment here. So I want you to sit up tall or stand up if you're standing up. Otherwise,
Tina, do you want to
tall.
stop the screen share? Maybe
Oh,
we could all
yeah.
kind of see each other.
Yeah, I'm just gonna. There we go. Nice. Okay. So if we could all sit up tall, get a nice position here. So if you can have your feet flat on the floor, please do. Sitting up tall, we're leaving a lot of room for our abdomen to move. So nice straight back. You can lean forward a little bit by hinging at the hips, not rounding the shoulders or the back. We're still straight, but some people like to rest their hands. I like to do open palms resting on my lap. Or you could lean back in your chair if that's quite comfortable for you. So just make sure you're sitting up tall and relax those shoulders down. I like to do a couple of shoulder rolls in both directions just to loosen up a bit. Sometimes if you bring those shoulders right up to the ears and tense them up for a second, you'll be able to relax them down a little bit better. All right, so get in that nice position, nice and relaxed. And then what we're going to do is we're going to take some nice, slow, deeper breaths, not as deep as you possibly can, just a nice, comfortable, deep breath in through the nose. And you're going to exhale through pursed lips, which is like you're blowing out a candle. Making that little hole between your lips is what helps us extend the exhale. Keep on breathing in through the nose, out through pursed lips. And if we extend the exhale, we can get out all of that old air, and it helps to slow down our respiratory rate. So our breathing pattern slows a little bit. It can be relaxing. Sometimes we like to count. That helps give us something to focus on, and it can also help to slow and relax the breathing. And so you might want to breathe in for a count of 2 or 3, maybe even a little pause at the top, and then maybe exhale for a count of 4 or up to 6. Do what works for your breath and your state. Sometimes people find that it's difficult when they're feeling short of breath to breathe in through the nose. So breathe in through the nose whenever you can. And as you start to get more comfortable with it, you might find that you can breathe in through the nose with every breath. So nice breath in, maybe a little pause, and then a longer breath out, maybe for double the count that you breathe in for. Bye, Jeannie. Thank you. Good to see you. Let's just take a couple more breaths together before we end off.
Bye, Jane.
Yeah, my tablet's dying.
Oh,
See you. Bye.
Bye,
Bye.
Jane. Thanks for joining. One more big breath in and big breath all the way out. Through
Bye,
those
Teresa. We'll
pursed
see you next
lips.
time.
Yeah.
And as everybody's letting go, we'll just let our breathing return to normal. If you want to keep on doing the pursed lip breathing, please do. If you're just starting out, maybe just a cycle of about 5 breaths or so can be a good way to start.
Bye, Gord. It was nice to meet you. All right. So as per usual, not as per usual, but we had such a good pulmonary rehab session. We're right at 3 o'clock. Those who have any questions and would like to stay on to ask questions, feel free. We're happy to stay on for maybe another 5-10 minutes. Now that we're all relaxed after that first lip breathing. So let us know in the chat, or you're welcome to unmute if you have any questions about pulmonary rehab.